Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates. It's a beautiful drive to work today, and today, on this episode of Simply Health Podcast, I want to talk about perimenopause bloating and menopausal bloating. And this is one of those things where it's really, really frustrating. I've had a lot of clients say, it's like, okay, I'm finally at a stage in my life where I don't have to worry about getting pregnant anymore. But yet now, all of a sudden, I actually feel like I'm 6 months pregnant all the time. And this bloating is something that we can address, and we're going to go over a bunch of points today to help you with that. So if you're struggling with this, pay attention. So I've worked with a lot of clients over this concern, and it's very common. People, they show me their stomach, they give it the old tap, like as if there is a baby in there, because that's what it feels like. And there's been several different factors and features that I've noticed that can help give you some guidance and roles in terms of what you need to address if you're struggling with this. So the first one, as commonly, especially more so for the perimenopausal age, is estrogen dominance or excess estrogen. So this can be verified with testing. But what you normally notice with this is that the type of bloat you're looking for here is that it's not just like the lower abdomen, like as if you were pregnant. It's almost like their entire torso feels bloated. So their lower abdomen, their upper abdomen, they feel kind of just puffy around the sides. Even like their chest and everything feels puffy. And it's almost like they are gaining weight all around their torso. So there's weight gain and the bloating all happening together. And when you see that, probably looking at excess estrogen, especially if it's perimenopause. This is not as common when it's full menopause for this type of weight gain, but depending on where someone is in their menopause. But mostly common in perimenopause. So getting the estrogen checked, and if it is high, using herbal extracts to help your body detoxify these excess estrogens. The second thing that we see is not so much, though it is related, is low progesterone. So you can have elevated estrogen and then you can have lower progesterone. Both are considered kind of estrogen dominance. But the lower progesterone, when that's the case, if estrogen's fine and progesterone is low, then it's the bloating that almost feels like bloating like the bloat you would feel with like PMS or like before your period. Like, so it's really, really, really lower abdomen, and it feels like bloating in and around the uterus, like right at the bottom of your abdomen. So when you see that and that kind of part flaring up, you're thinking low progesterone. And again, extremely common in perimenopause. And this can happen way before menopause kicks in, like easily 5-8 years before menopause kicks in, you can start seeing these types of symptoms. And if that's the case, again, you'd be ruling that out by checking your progesterone. And if you need to, if it's early on, you could use herbs to kind of help balance your progesterone, but if it's getting later and that's not going to cut it, then you can use a bioidentical progesterone cream to balance your levels out. The third type of bloating that we see in perimenopause and menopause is actually related with constipation. And it's strange how many people don't pick this up. When you see the bloating where it's mostly for this type of bloating, it's not as low as just the progesterone type bloating or just your lower abdomen. It's more like your entire lower abdomen up to your belly button. And when you see that, then I'll ask, okay, so how often do you actually go to the bathroom? And it seems, like I said, it seems like it should be obvious, but there's a lot of people whose just bowel habits have been so off for so long that because it's normal for them, they think it's normal. So like, oh yeah, I only go every 2-3 days. And then you're like, well, do you notice that after you go to the bathroom that your bloating's not as bad? And they're like, well, now that you mention it, yeah. That is something, the treatment for that is dealing with the constipation. And I've got an earlier episode you can go back to look on the 5 or 6 steps you can work on to deal with your constipation. But if you're constipated, I guarantee you are going to be bloated in your lower abdomen. The next type of bloating that you see is where you start to see people get sensitive, and this happens a lot as we get older, but you get more sensitive to too many refined carbs and sugars in your diet. So too much flour, too much breads and pasta, and that you will see where there's bloating often affecting the upper abdomen, so above your belly button, or the entire abdomen. Like not just like a pregnancy lower abdomen bloat, but I mean your entire abdomen sticking out, but you don't get the fullness in the chest and stuff like that you would see with estrogen dominance. So in this type of bloating, usually the person wakes up fine and they're like, look at my stomach in the morning. I've had people who are bringing pictures, like, here's 2 pictures. Here's a picture of my stomach in the morning. Here's a picture in the afternoon, just so you believe me. And when you see that type of bloating and it affects that, and it often it really starts kind of picking up after lunch, that's related with just your diet. You need to pull back and switch to a lower carb diet. And when you do that, you will see that type of bloating reduce. The other thing that I've found that helps that quite a bit is doing things to stimulate your digestion. So commonly people would think of, okay, I'll use digestive enzymes, but I actually have found that bitters work better for stimulating your digestion when you're getting this full abdominal bloating. So you pull down on the carbs a bit and switch to bitters. And what bitters are, I'll explain that. Bitters are herbs. They're called Swedish bitters. There's Canadian bitters. Maybe if you live in different countries, they call it their own name for bitters. But they're herbs that are bitter, and they stimulate your digestion so that when you are eating foods, instead of just kind of sitting there and fermenting and causing all this gas and bloating, you're breaking them down better. When you improve your digestion, you will notice less bloating consistently. It would take a little bit more training to go beyond this, but one thing is that when it comes to bitters, you usually want to make sure that you're using balanced digestive herbs. We don't really have time to go into that in this episode, but a lot of bitter herbs are considered to be very cool herbs or cooling herbs in Chinese medicine. You kind of want to balance it out with ones that are warming. So try and add some things like, what would be some warming bitters? Angelica, make sure some ginger is in there, and then you can add that to your other bitters. But again, maybe I'll get into more detail for that in another episode. The fifth thing that you'll see with bloating is inflammation. So in this case, when you're seeing bloating, but then the person's also noticing water retention in other joints, especially if it's like non-weight bearing joints, like your hands are always puffy, and even more so when you wake up in the morning and you're feeling really stiff all the time. You'll see it a lot in people's hands and in their ankles, even though those are weight-bearing joints, obviously, but puffiness in the ankles, puffiness in the hands. Then we're dealing with an inflammation bloat. This is a little bit more in-depth to treat because then you're switching to more of an anti-inflammatory diet, eliminating foods and then reintroducing them after to find out what the real problematic foods are. And don't worry, I definitely will be going into a lot more detail for this in a future episode. But if you're getting that type of inflammation and that type of bloat where it's just puffiness all over with all of this stiffness, you've got to address the inflammation. And keep in mind, it's pretty common that it's never just one of these 5 things I mentioned. It's almost always a combination of 2 or 3. So you want to make sure that if you're having any of those issues, that you're addressing all of them. And that can be quite simple. Like it could be literally as simple as switching to a lower carb diet with reduced inflammatory foods and then putting on some progesterone cream at night. And then the difference that you would feel would be huge. It would be, yeah. Again, these are all very, very rewarding things to treat because it's awesome making people go from feeling like a 0 out of 10 to like an 8 out of 10. And that's almost always, with what I've mentioned, within a month you can see those changes. Now, there are a few exceptions to this rule, and these would be extreme cases. So just kind of as a, when to see your doctor to get things checked out. In like severe liver issues, you can see severe bloating of the lower abdomen. And at that point, it's not like bloated with air. It literally is like the abdomen is hard like a drum. And I mean really hard and puffy. And in those situations, you got to go get that checked out. Go to your doctor. You can't self-diagnose everything. But for these more basic cases where you just have this fullness and bloating, that's going to be ruled out with most of these. The liver one that I mentioned, it's much more rare, and much more of considered it's just not as common to see that. But if you do have experienced anything like that, get it checked out. Sorry, a little bit of a side ramble there. So just to review, excess estrogen, that's going to be entire torso. Too low of progesterone, that's going to be the very lowest part of your abdomen. Constipation, that's going to be more from like around your belly button and down. Too many carbs or an inability to digest carbs as well as you used to, that can be mostly upper abdomen or the entire abdomen. And then inflammation, it can be anywhere in your abdomen, but it's going to be accompanied often with swelling elsewhere and stiffness, especially in the morning. So I hope this has all been very helpful for you, and it's going to help you guys out if you're dealing with any of these issues. And this is Doc Yates signing out. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.